people, welcome back again to another health episode with Asasika. If you're new to this channel, kindly subscribe, share, and don't forget to send your comments in the comment section. To my returning subscribers, I say thank you so much for your support. Even though I have been off and on, but you're still supporting me. Thank you so much, and I love you all. There are some of you here who take antibiotics without doctor's prescription, and I wonder why you do that to yourself. Why would you do that? I'm talking to you that you're watching me, So stay tuned, and I'm gonna give you the reasons why you shouldn't take antibiotics without your doctor's prescription. Don't go anywhere. So the funny thing is that some of you have turned yourself into doctors and pharmacists, okay? You were working with experience, thinking you're on the right track. But bro, my sister, no, you are not. Never buy antibiotics without a doctor's prescription. Never do that. It's not gonna help you. Yes, because everything has a consequence. We are here to help you, okay? Go to the hospital, pay consultation fee, see the doctor, let him or her examine you, okay? And give you the right medication. And when you get your prescription, walk straight to the pharmacist at the pharmacy and take your drug. Don't sit at your house, your room, and be analyzing stuff. The reason why I'm saying this is because medicines, okay, have side effects, okay? Every drug that you're taking has its own side effect. Apart from the side effects, every drug has its complications, and then a lot of things that we have to consider, okay? Maybe you might be taking another drug, and because you're not consulting any doctor, you go and buy this particular drug, and there might be some interactions, okay? So always seek a doctor's advice. Even if not a doctor, seek a pharmacist's advice, okay? Let them do their job, okay? So they can help you. That is why we are here. That's why they are there, to help us. Yes. So as I was saying, antibiotics are medicines or drugs that are used to treat bacterial infection. Yes. And in our body, one thing you should know is that we have good bacteria and we have bad bacteria. Yes. And these bacteria are germs. You can find them outside of your body and inside of your body as well. The good bacteria that are inside our body are harmless, okay? They do us good more than the bad. They are helpful to us, These antibiotics, okay, they either kill the bacteria or stop the bacteria from growing. That means it inhibits its growth process, okay? So if the growth process of the bacteria is being stopped, infection wouldn't spread, okay? Yes, depending on how aggressive your infection is. So there are different types of antibiotics available, different types used for different indications. You might not know what kind of infection you are having. Maybe you might be having UTI. You go and take an antibiotic which is used for treating respiratory tract infections. It wouldn't work. At the end of the day, it will end up giving you more problems, doing you more harm than you already had. That is why you shouldn't take antibiotics without a doctor's prescription. Are we on the same track? I guess we are. Nobody's missing. There is something we call antibiotic resistance. Earlier I said antibiotics are used to kill bacteria or stop their growth, stop the bacteria from multiplying, or growing the process, meaning it will decrease the infection. Yes. So this occurs when the bacteria develop a certain ability to defeat the antibiotic, meaning the antibiotic is no longer effective. It's not able to kill the bacteria, or it's not able to stop the growth due to some changes the bacteria has made in its system, mutated cell. So bacteria are kind of germs, which is very dangerous. They can change anytime. The moment they get the opportunity, they try to multiply, okay? If antibiotics lose their effectiveness, okay, it's not able to treat the infection, leading to sepsis a severe form of infection that affects the whole body. Now, here are the main causes of antibiotic resistance. 1. Overuse of antibiotics. You don't need antibiotics. Maybe you've been prescribed to take an antibiotic. Now you're taking more than required. Now you're a doctor. Now you know what is best. The doctor says take it for 5 days. You think, okay, 5 days, I don't think 5 days will be enough. Me, I'm taking for 10 days. Are you a doctor? Don't overuse your antibiotics. Don't take too much of antibiotics when not required. Listen on. 2. Misuse of antibiotics. You woke up one day and you feel that, oh, I'm having this sore throat and I think it's an infection. Okay, it's an infection, obviously. What kind of infection? You've gone to the drugstore, you bought antibiotics, you're coming to take. Okay, these sore throats, most of them are caused by viral infection, not bacterial infection. And what you should note down is that antibiotics, bacterial infection, not viral infection. So don't prescribe antibiotics to yourself. You end up causing more damage to yourself. Listen on. The third one is patient compliance. You dear, you think you know everything. You've gone to the hospital. You have an infection. Doctor has given you antibiotics. Sister, brother, take it for 5 days. So, me no. After 2 days, I'm feeling good. So, I'm not continuing the medication. Who taught you that? Who taught you that? Do not stop taking your medication because you think you're feeling good. Doctor said take for 5 days. You, because you're Oga, you take for 2 days because you think you're feeling better. Listen to your doctor. And also, do not stop your medication without his consent. Why will you go to the hospital? The doctor has not told you, okay, you can get off the drug, or the doctor has not giving you a duration for like, take this thing for 7 days and after that, stop taking it. He has not said anything. You think, okay, since I'm feeling good, I guess the infection is okay. So, you stop taking the medication. Let me salute you. Don't do that. Do not stop your medication without consulting your doctor first or your pharmacist. Lastly, never take someone else's medication. The infection that you are having wouldn't be the same infection he or she might be having. So why are you taking other people's medication? Why? You ask me, who I go ask? I go ask you, why? Why are you taking people's medication? Why are you taking other people's antibiotics? Don't do that. Never do that. But rather, do this. Take your medication as prescribed. If it's for 5 days, take it up to 5 days. If it's for 7 days, take it. If you think you're feeling good, go and see your doctor and let him give you the consent to stop your medication. Don't do it on your own. 3, don't take other people's medication. Do not. It wouldn't help you. Never miss a dose. Never miss a dose. Please. It's very important. Yes. And don't forget, as I always say, do your best to stay healthy and keep others healthy. Until we meet again next time, take care of yourself. Bye-bye.